Libby Znaimer on Zoomer Radio brings you prescribed listening from our trusted contributors at the Ontario Pharmacists Association.
I am here with our trusted contributor from the Ontario Pharmacists Association, John Papastergiou. And we have all heard about naloxone, the use of naloxone to reverse an opioid overdose, about how it can save lives, about how there are free naloxone kits that you can get at the pharmacy, and how people are being encouraged to use these kits if they see someone having an overdose, if it's a loved one, because, you know, this opioid addiction can happen to just about anyone. But the bottom line is that a lot of people, I would say myself included, would feel very uncomfortable about trying to do that. So John has arrived here with a naloxone kit, and he is going to talk about it and show us on camera how to use it. Hi, John. Thank you so much.
No, it's good to be here. And, you know, we're talking about a really important topic today. It's essentially a crisis going on across Canada. And I think pharmacy's really been called upon to get involved with managing, you know, this important problem. And naloxone kits now are available for free in community pharmacies. They're available to anyone that's taking any opioid, really. So I think one of the big misconceptions is that, you know, these kits are only for, you know, street drug users, heroin addicts, things like that. Absolutely not. We're talking about prescription opioid medications. Many patients are on them. It's very easy to kind of forget to take forget if you've taken a dose and double your dose. You know, for people that may erroneously, you know, use the wrong medication, anything like that can put you in a crisis situation. And that's why we're making sure that patients that are candidates for a naloxone kit have one at home and are trained to use it. And that's an important aspect of this.
Okay. Can you have the kit there? So show it to...
Absolutely. So this is a naloxone kit right here. This is what you get in your pharmacy. It's packaged in this nice little kind of a velvet case here. And once you open it up, you'll see there's a bunch of different things in here. And the most important thing you'll notice is that there's 2 doses in there. So there's 2 amps. I'll take this out and show you. So this is the actual naloxone. It's you know, contained in an ampule. The reason that there's 2 doses in the kit is, you know, naloxone's not a Pac-Man. It doesn't eat up the opioid that's in your body. What it does is it reverses its effects at the receptor. So it only lasts about an hour. So if a patient is overdosed with a lot of opioid and say they're far away from a hospital or medical care, in theory, they may need a second dose. And, you know, if you go over that 40 minutes, hour mark, you're most likely going to need one, very similar to epinephrine and an EpiPen for patients that are having allergic reactions, right? So what else is in our kit here? So this is the ampule here, and this contains the actual drug. There's a syringe here that you're going to have to kind of draw the medication up in and
so you break the ampule.
Yeah, so the first thing you would do is you break the ampule and you just pop it off.
It's, it comes off.
Do you want me to do it? I can show you guys. I just you know, that's
okay.
it right there. So it's drawn, and you can see if you do it the way I did by using your hands, you can get a sharp edge. There's actually a little tool in here that would help you break it. It's this thing here, but I find in an emergency situation,
just
you're rushing,
break it.
Just break it.
Okay,
I mean, it's very simple to break.
Do you want to show us how to?
Yeah. So here, I'll just leave this here. What would happen next is now you'd have to draw up the medication. Very simple. You take off. There's an exposed needle here, right? And you would pull down the ball. You could pull down the plunger and put some air in, but you don't really need to do that. So what I would do next
is... So the plunger is all the way in.
All the way in, and now you would just draw it up, right? So I'm going to try drawing up a bunch of naloxone there. And you get everything that's in the ampule. Sometimes there'll be a little bit left. If you get some air in there, you don't have to be a nurse. It's okay. We're not giving this in the vein. We're just giving it intramuscularly, so it's fine to do that. So if you see now, I've got all the naloxones kind of in the syringe. Now you're pretty much ready to go. That's how simple it is. I say it's simple, but you know, if you're in a crisis situation, it can be a little nerve-wracking for someone that's never given this, because you got to remember, it's not the patient that's self-administering. At this point, the patient is unconscious, right? So it's someone that knows them, a friend, family member, or whatnot. And that's why we try to encourage, you know, friends and family members to be trained as well. And the program allows for that. So if they have someone that's on opioids living at home, it's okay to come into the pharmacy and get trained.
Where do you inject that?
Where do you think? I think we may have talked about this before. There's a common misconception around this. That's why I ask. When we asked patients in our pharmacy, we did a kind of a pretty large survey. Guess where the most common answer was, where people thought they had to inject this?
And
we were talking about it out in the green room.
In your behind?
No, in the heart.
People thought in the heart?
And you know why?
It's because of the movie.
Pulp Fiction. So they did that in Pulp Fiction, right? And people think that's where you do not inject this in the heart. That's very important. First rule of thumb. This is an intramuscular injection. You could give it like a flu shot right into the arm if you want.
Okay,
right
but you have to take all the clothes off, obviously.
Yeah, I mean, if you're panicking, you could go through the clothes too. It's going to be a little bit harder. But yeah, try to expose the arm and get it through. Same thing, you could put it in the leg, but it's an intramuscular injection. That's very important.
Oh, so you don't need to put it in the behind?
No, you don't have to, unless you really want to. You probably do that. But you really want the naloxone to get in an area where there's a lot of blood flow, right? Because the quicker it gets into the bloodstream, the quicker it's going to be able to counteract the effects of the opioid, right? So, the arm, I think, is a real easy place to do it. It kind of in that deltoid region there, or in the thigh. It's easy to do. And you see, this is a pretty long needle, eh? So this is not a needle we use for flu shots or whatnot. So this will actually, if you need to, go through a fine.
Can I see the top of it? Yeah, so you just push it down.
Yeah, that's it. Yeah. So if I were, I don't want to spray it
all
over the place, but if I push it down,
don't.
I just spray up. Yeah, and that's it. And I mean, when I first, we first became aware of this in pharmacy, I had some concerns around people that have never given a shot like this. It's not hard, but in a crisis situation, it can be a little bit nerve-wracking. So it's well worth getting the training. There are other things in the kit as well. So, I mean, there's an alcohol swab here. So if you expose the skin, ideally you want to kind of rub it down with a little bit of alcohol. So
beforehand.
Before you inject, right? Yeah. So it just looks like this. It's just a regular alcohol swab. And then there's some gloves here for say it's a stranger and you're not sure if you want to administer the naloxone without gloves. You can wear the gloves. You don't absolutely have to, but you could put on the gloves. And we also have a face shield, and this is if you have to administer CPR, right? The CPR guidelines have changed a little bit too. They don't generally recommend breathing into the mouth anymore. You can just do the compressions, but there is a face shield for anyone that's trained and knows how to give CPR.
Oh, because there was something about that recently where I think some officials were saying you should give CPR, but again, it's the same thing. If you're not trained,
there's a risk. Yeah, you should be trained. I think anyone that's taken first aid certification should give the CPR. If you're not trained in doing it, you could actually cause quite a bit of damage. So it's not something you should do if you don't have the appropriate training. And like I said, I'm not an expert in CPR, but I think that the last time I took the course, they were saying you don't even have to do the breathing in. You just do the compressions now, right? But this is in there and available if anyone wants to use it. That being said, this seems pretty complicated. It's there. It's not as bad as it looks, but speak to your pharmacist if you think you feel the training. But we have another solution available in Ontario now too, and this is the intranasal naloxone. I'm not sure if you've heard about that. This is now being covered in Ontario pharmacies also by the Ministry of Health. It's a much easier to give. This is all it is. So what you do is you would put this into the patient's nose. You press down on that plunger. This is just a demonstrator.
Okay.
And the naloxone would shoot up into the nose.
Okay.
Right?
So like, why would we even go there?
And
do you
only recently covered.
Okay.
Right?
So, and do you hold the other nostril?
Don't have to do
no,
that.
No. It's just in one nostril.
Just in one nostril. The most common question I get is this going to work if the patient's unconscious? They're not breathing, right?
Yeah.
It doesn't need to be inhaled. It actually just gets absorbed through the mucosal membranes of the nose. There's a lot of blood flow there, right? Same thing. This is not an antidote that's going to last forever. You got about 40 minutes to an hour, depending on how much opioid the patient's taken. You've got to get them into the hospital as well. Again, this was recently covered by the ministry. I think partially because it's ease of use. It's much easier to use. It is actually dramatically more expensive than using the injection, though. So they've made the investment, obviously, because we were dealing with such a big crisis.
Right. I know what I'd rather use.
Oh yeah, Even me as a caregiver, as a healthcare provider, this is way easier. I mean, if you've never given an injection, it takes a little bit of skill and confidence to do it, but that's what the training is for. So if you pick up either of these in a pharmacy, there's no real training involved in this. The pharmacist will show you how to do this, but there is actually training that's done by the pharmacist to make sure they're confident that you're able to give a dose if you need to give it by injection.
Okay, let's go to Margaret in Kitchener. Hello, Margaret.
Hello. Nobody likes me there, but however, I would like to know who makes these naloxone kits and who pays for them.
Great question. So actually, it depends on the pharmacy. The pharmacy could put a kit together. There's certain requirements of what has to be put into the kit. When this program first launched, we were just, buying the syringes, separately, buying the naloxone obviously separately, and putting the kit together. Now there's actually companies that have kits pre-prepared. The only thing the pharmacy would have to add is the ampules of naloxone there. And then it's paid for by the Ministry of Health. That's part of the publicly funded program now. So if you qualify, you come in, you show your health card, and we would give you a kit for free. So the patient wouldn't have to pay, but obviously the government does.
So which company makes the kits?
Oh, they're distributors. You just buy them. Yeah, but the naloxone wouldn't be in the kit. The pharmacy would add that.
Right.
Thank you.
Okay.
Yeah.
All right.
You're welcome.
We have a call all the way from Ohio. Tom in Ohio, go ahead. You're on the air.
Yes, I just had a question. What if you gave the shot and they weren't having an overdose and they didn't need the shot? Do you cause another problem?
Absolutely. What a great question. That was on my list of things to talk about. So, no, that's a great thing about naloxone. So say the patient is unconscious because, they're having a diabetic episode or something like that, and you're not sure, and you give them a shot of naloxone. Really, it's actually very, very inert. Remember, I said it's just blocking the opioid receptor. Worst case scenario, that patient, when they wake up from whatever they're suffering from, they could get some diarrhea, some stomach upset a little bit. But the reality is it's not dangerous at all. So if you need to err on the side of caution, give the injection if you're not sure, or if you suspect there may be a chance that they've injected a large amount of opioid. Say they had a heart attack and you inject it. Again, nothing's going to happen to that patient because it's not really a stimulant like epinephrine or anything like that. So short answer is you don't really have to worry about causing any harm when you give naloxone.
Okay, great. Thanks.
You're welcome. Okay, let's go to Jennifer in Scarborough. Hello, Jennifer.
Hi, how are you?
Fine. How are you?
I guess you just answered the question I was about to ask. I was just about to ask if you don't know if the person is suffering from a drug overdose and maybe they are diabetic. I was just going to ask the same question.
Yeah, it's a good question we get a lot because people worry about that, right?
Yeah.
Worst case, they don't want to cause any harm. And, if you see a patient lying there, which you do, the reality is you're going to only inject naloxone or give them the intranasal dose if you suspect they've had access to opioids or they're an opioid user. I mean, now we know many of the street drugs are laced with fentanyl, right? So we've got, teenage kids and young adults dying, cocaine being laced with fentanyl. Fentanyl is a very, very potent opioid, right? A small amount, so minuscule amounts of it mixed in, with these street drugs could cause, patients to die. And the reality is in those scenarios, if you're not sure, you're safer to inject the naloxone. And if it is opioid related, I think, people that have ever seen this, you'd be amazed how quick the patient responds. It's almost instantaneous. The minute the naloxone gets into the blood, patient's eyes pop open and they're alert. But again, it won't last forever. That's just the thing. If they've taken a lot of opioid, you may get 45 minutes, max up to an hour, but you got to get that patient to the emergency room.
Call 911, administer it, and call 911. 911.
Similar to an EpiPen, same message for anyone that has anaphylactic allergies. If you use an EpiPen, it's not a cure. You still got to get them to the hospital.
So is there a different reaction than just passing out you have to look for?
Well, no, I mean, someone that's, it's a cascade, right? So if you've taken, too much opioid, generally the first things you start seeing is they'll tend to be drowsy, start to fall asleep, you get respiratory depression. But if they're absolutely unconscious, not breathing, that's the worst case scenario. That's a severe overdose, and you better manage that very, very quickly or the patient can die.
Okay, thank you very much.
Problem.
Thanks, Jennifer.
Bye-bye.
Bye-bye. Now, both our callers and you mentioned that it could be a diabetic coma. Why don't you tell us a little bit about that? Because a lot of people out there have diabetes.
Yeah, so I mean, and generally we don't see that with the type 2 diabetics. That's the type 1 diabetics, right? That will go into like the diabetic shock where they, their blood sugar gets so low that, they may pass out or whatever. To manage that is different. Generally, we give those patients either sugar, and that will wake them up. In the most serious situations, there's a drug called glucagon, right? That will kind of reverse the effects of kind of a severe diabetes reaction. That's not as common. It does happen, but most of our patients with diabetes, I think, are pretty well managed. They know the signs as they start to get really low, and they're able to manage that. But, I know our paramedics do deal with it quite frequently, and they're different treatment than this, but it can be managed also. So I think for, most patients with diabetes, especially if you're prone to suffering from lows, just be aware of the signs, right? You don't get the tremor, the kind of the sweats, you feel unwell. If you have diabetes, that's probably a good sign that, hey, my blood sugar's dropping less than 4 here. I better, get some sugar in my body, and that will generally reverse it.
Okay. Mel in Toronto. Hello, Mel.
Hi, how are you, Libby?
Fine. How are you?
I'm okay. My question is, do we have geographical areas that are pinpointed by the government, which is mostly used, about, this opioid?
The crisis has gone nationwide now. Of course, there's regions that, there's definitely pockets where we see more opioid abuse, but I wouldn't say there's parts of the country that are immune to it. This is something we're seeing coast to coast. It's happening in Toronto. It's happening all over the place. So it's become such a crisis that, it's on the top of, every healthcare professional's mind, I think, right now. And in some areas like Vancouver, it's really, really bad.
Yeah.
And they're having deaths there. Some weekends they're seeing like 20 deaths from opioid-related overdoses. So this is not a small issue, and it's, a part of it is due to prescription opioid drugs for sure, and another part is due to street drugs being tainted with fentanyl, and that's it's a whole other problem, and that's fentanyl powders being made available now, and these drug dealers are mixing it with street drugs to make their product a little bit more potent. And unfortunately, if you're opioid naive and you happen to get one of those batches, very, very serious consequences. If you don't die, you could be suffer from serious long-term effects as well. And some of these kids, you hear the stories; it's horrible. Naloxone will help with that as well, but it's got to be available.
One more question. Are these suicides or drug-related things are more concentrated on poor areas rather than wealthy areas?
Well, listen, I mean, I know it's, maybe there's, certain pockets of, lower socioeconomic kind of areas are maybe more prone to certain drugs, but it's not by any means a problem just of the poor. This is a problem that we're seeing across demographics. People all over the country, like I said, are suffering from this. There's prescription and non-prescription kind of causes related to it, and it could be your friend, it could be your neighbor, it could be the old lady down the street that has some memory issues and she's forgotten that she's taken her hydromorphone once today and takes it another 2 times, right? So it can be anything, and I don't think
people get addicted. They're taking painkillers after surgery that they need, and it happens.
Yeah, I think we have to be very, very careful not to stigmatize people, based on some of our misconceptions, because this is happening, like I said, across the country, across demographics, and it's something we gotta kind of deal with.
John, we don't have very much time left. What would you like to leave us with on this?
Yeah, I think the biggest thing is if anyone's concerned, if anyone's taking opioids, and I'm talking even like occasional prescriptions, things like Percocet that you may be taking occasionally for pain, and before you know it, maybe you need more because your arthritis is getting worse or whatnot. Go and speak to your pharmacist. It doesn't hurt to have one of these kits at home. You never know when you're going to need it. Get trained. You may be able to save someone's life because of it. And it's a 10-minute interaction with your pharmacist. All you need is your health card. Let's get these kits out to as many people as possible, and hopefully we'll save some lives because we have a real big problem on our hands.
Okay, I found this very, very instructive and important. John Papastergiou, thanks so much for coming by with the naloxone kit.
It's great to be here. Thanks.
Okay, and that is all the time we have for Fight Back for today.